On average, approximately 1,700 patients on a monthly basis are admitted to the Accident and Emergency Department of the Millennium Heights Medical Complex, Mhmc. According to Dr. Bernadette Joseph Labadie, more than half of those patients are suffering with non-communicable diseases like diabetes and high blood pressure.
We would like to encourage the public to take better care of themselves. Have a balanced and healthy diet, quit smoking, drink in moderation, take your medications to avoid the complications that we see every day from the non-communicable diseases such as the strokes and chronic kidney disease, as well as COPD, which is chronic obstructive pulmonary disease. Drive safely, wear your seatbelts or your helmets. Please do not text and drive, and try to resolve conflicts without the use of violence.
The cautionary advice to the general public is being amplified due to the increase in hospitalizations, which Dr. Joseph Labadie asserts is straining the medical institution's capacity.
Due to the number of very sick patients seeking care over the last several months and the increase in patients requiring admission to our wards, the hospital has been grappling with a shortage of beds to care for our patients. This situation is further compounded by the increase in motor vehicle accidents and injuries due to violence, such as gunshot wounds and stab wounds. As a result, some patients who require admission to the hospital are kept in the ER, where they are cared for until a bed becomes available on the wards. Over the past few months, on any given day, the ER has between 25 and 30 admitted patients waiting for beds on the wards.
Dr. Joseph Labadie explains that the A&E department has 23 beds, and a surplus of admissions can result in long wait times for patients seeking treatment.
And we understand that this is a difficult situation for both our patients and their relatives, and therefore we are constantly seeking solutions to resolve this problem. One of these solutions was the opening of a special 7-bed unit called a transition unit for stable patients whilst they await a bed on the ward. And this transition unit is adjacent to the emergency department. We have also made beds available at the secondary care hospital, previously known as the Victoria Hospital.
If we do not find a whole of society solution to dealing with the social cases, we will not be able to expand our bed capacity. This really requires families who have their loved ones at the hospital to take these patients back to their care and manage them within their home setting. There's an excellent primary care network. If there's a need for care, these patients can seek care at the network. But we will be constrained in expanding our beds and, by extension, fulfilling the requirements and the policy decision of the government to set up this secondary care hospital.
The medical institution says it is working to improve the overall patient experience.
When a patient arrives at the ER, resulting in a smoother flow, and this includes a new registration area and triage room, where the nurse now has greater visibility of the patients in the waiting area. And these works are expected to be completed by the end of June.
If you're feeling unwell, use your primary care facilities first before presenting to our emergency room. Because when you present to us for non-emergency care, we have to now divert resources to take care of you, and therefore those patients who are in the back with in the chronic conditions and the injuries from accidents and violence, therefore will be compromised.
The challenges at the ER have also impacted the staff who care for the sick, injured, and hospitalized. Their dedication did not go unnoticed, as the head of the department applauded their efforts during this difficult time.